Thank you again for joining the Finance Committee. Today is Tuesday, April 1st, and we are in our voting session, and we're going to start with bills for concurrence. And I guess we'll start with David.
Yes. So you have two lists in front of you. One is blue, that's the concurrence list, and the other one is the regular voting list. So if you go to the top of the concurrence list, the first bill is Senate Bill 776. This is the work group to study the rise in adverse decisions in the state healthcare system. You've already passed the House bill. 776. I got my order. I'm out of order. Sorry. I meant to start at the top. Let's just go to Senate Bill 156. Okay. Sorry.
Come on, David, we're tired.
Yes, I know. My phone's. Okay.
You should be so lucky.
Okay, so let's start with Senate Bill 156, the work group on newborn nurse home screening services. Senate Bill 156 establishes a work group on newborn nurse home screening visiting services. You passed the House bill recently, which is amended the same way. The House amendments add members to the work group and duties and alters the staffing. So I think you'd want to concur here to be consistent with all your other actions.
Motion to concur. So Senator Hayes and Senator Kramer, motion to concur. All in favor of concurring on Senate Bill 156? Thank you. Unanimous vote.
Okay, the next bill is Senate Bill 372. This is the Preserve Telehealth Act of 2025. The bill makes permanent provisions of law specifying that telehealth include audio-only telephone conversations between healthcare provider and a patient. The House amendments alter the prohibition on healthcare providers prescribing opioids through telehealth by providing an additional exception when there is an ongoing bona fide provider-patient relationship that included an in-person assessment. You just passed the House bill recently with the same amendment. So to be consistent, again, you would vote to concur here because the bills would be identical.
Move to concur.
Senator Hayes and Senator Kramer, all in favor of concurring on Senate Bill 372? Unanimous vote. Thank you.
Okay, and at the bottom of the list where we actually started, this is Senate Bill 776 and the work group to study the rise in adverse decisions in the state healthcare system. Again, the bill establishes a work group to study the rise in adverse decisions in the state healthcare system. The House amendment adds another physician to the work group. You added another physician to the House bill, so if you concur, the bills will be identical.
Motion to concur.
Move to concur.
Senator Ellis and Senator Hayes.
We rolling, we rolling.
All in favor of the concurrence?
Madam Chair bill, that's why.
Yeah. Thank you.
All right, I'll go next.
Okay.
Next on the list would be Senate Bill 594. This is a bill from Senator Ellis that authorizes alters the authorized uses for the opioid restitution fund. The House amendments authorize the fund to be used for addressing socioeconomic disparities in access to prevention, harm reduction, treatment, and recovery support services. So this amendment would align the Senate bill with the cross-filed House bill, which passed the Senate Finance Committee earlier this session. So a motion to concur would keep them aligned.
Senator Ellis made the motion. Who seconds? Senator Jackson. All in favor of the motion concur on Senate Bill 594? Unanimous vote. Thank you.
Next is Senate Bill 684, which requires the Department of Health, in collaboration with the Commission on Health Equity, to develop a clear and easy to understand health disparity data dashboard. The House amendments require the dashboard to include information on body mass index. Again, the amendment aligns the Senate bill with the House cross-file that passed the Finance Committee earlier this session. So a motion to concur would keep them in line.
Senator Ellis and Senator Guile, all in favor of the motion to concur on Senate Bill 684? Unanimous vote. Thank you.
Next on the concurrence list is Senate Bill 226, the Maryland Farms and Families Fund. It's a departmental bill that modifies the stated purpose and authorized uses of the Maryland Farms and Families Fund within the Department of Agriculture. The House amendment is non-substantive and adds current law for context. It is, as amended, it is identical to the House cross-file as passed by the committee unanimously on March 25th and is currently before the Senate on third reader. A motion to concur would be appropriate.
Motion to concur on Senate Bill 226. Senator Guile and Senator Washington. Thank you. All in favor of the motion to concur on 226? It's a unanimous vote. Thank you.
And then next on your list is Senate Bill 665, which generally modernizes the Maryland Uniform Disposition of Abandoned Property Act, which governs the distribution of abandoned property in the state. The House amendments conform the Senate bill to the House cross-file that is currently on third reader before the Senate and passed this committee unanimously on March 27th. Moving to concur would keep the bills in the same posture.
Motion to concur on Senate Bill 665. I'm sorry, you were, who was first?
No, you moved.
Senator Reedy?
Oh, you were asking for a motion.
Yeah.
I make the motion.
Senator Reedy, second? Now I need a second. Senator Mounts. All in favor of concurrence on Senate Bill 665? Unanimous vote, thank you. Okay. We're going to go to Amber. Are you going to do the first?
Yes, I will kick us off with Senate Bill 614, and it has a companion House Bill 1020. They're in the same postures as I discussed this. You do have a reprint before you for 614 that we'll go through, but generally, as amended, Senate Bill 614 and House Bill 1020 are identical. The bills generally prohibit a consumer reporting agency from including certain information related to medical debt in a consumer report and prohibits a person from using medical debt information included in a consumer report to make a determination regarding creditworthiness. There are several amendments offered by the sponsor that generally align this bill with its cross-file as it passed the House. And there's an additional amendment offered by the chair to ensure that the definition for medical debt is aligned with the federal definition, as well as the bills that are moving through both chambers currently. So on page 2 of the reprint, there's just an alteration to the definition of medical debt, which aligns with the federal definition. At line 20, this is an amendment offered by the chair after a meeting with stakeholders to further align with the federal definition. It simply strikes specifically and replaces it with solely. Further down after line 25 on page 2, this is an amendment offered by the bill sponsor that alters the prohibitions for a consumer reporting agency and really lays out what a consumer report cannot contain, incorporate, or create. On page 3, amendment down about 3/4 of the way down the page. It's just requiring that hospital policies prohibit the reporting of adverse information to a consumer reporting agency. At page 4, it's a further requirement that hospital policies comply with the bill's newly established provisions. And at page 5, requires a hospital that has reported adverse information to a consumer reporting agency to instruct the agency to delete the information. Finally, at page 6, there's a sponsor amendment. It's just striking unused terms and definitions. And then at lines 14 and 15, just clarifying who is subject to the new section. So it's a person whose primary business is providing medical services, products, or devices, or that person's agent or assignee, as opposed to laying out healthcare facilities, practitioners, and ambulance services.
So Amber, that'll make these two bills conform to House Bill.
The two bills will conform. There are amendments on House Bill 1020 that are technical, and I have alerted the House to those amendments, but the bills are in the same form and same posture currently.
Senator Lamb?
Yeah, thank you, Madam Chair. I just wanted to go back to the provision on these credit cards. I think it's actually a significant change to go from specifically to solely, because that potentially really reduces the scope of this bill and what type of credit cards might apply. My understanding is that there's currently very few, if any, credit cards that are just solely for healthcare services. That there are other ones that are a little bit broader, that could be specifically, but by narrowing this down, you're basically exempting almost all these credit cards from the protections that are offered by this bill. The credit cards are significant because I think about a quarter of all medical debt in the country is held on credit cards. So by narrowing this down to just solely, you're basically taking out a lot of the credit cards that.
What page are you on?
This is page 2 of the
Around line
reprint
20.
on line 20, I guess. Moving it from specifically to solely would really narrow the protections that are offered to individuals, because there are very few credit cards that are just solely for the use of healthcare services. And so, a lot of these folks would be exempted out. And as I mentioned, about a quarter of all medical debt in the U.S. is, I think, held under these types of, or held on credit cards. And so there are other states that have looked at this similar provision too. Just for background, this is a bill that I think the Consumer Financial Protection Bureau at the federal level was looking to be able to institute through regulations. And then, obviously with all the federal changes, these were pulled back. And so other states have moved forward with this, including Colorado, Connecticut, Minnesota, New York, and they have used the specifically wording here as opposed to solely. So just really concerned about the narrowing scope of this, losing a lot of the protections that would be in place for people that might have these credit card debt.
So, Senator, this was brought to me because someone can have a credit card that they use for a lot of things, including medical debt. So let's just say I've run my credit card up to $10,000 and $4,000 is medical debt and the rest is whatever I want to spend. How do we preclude that from being part of the medical debt, having the other 6,000 part of the medical debt?
So I think they should be able, the holders of the debt are reporting that to the Credit Reporting Bureau. So, they should only be reporting the debt that's held that is in relation to medical debt, not, other consumer purchases, right? So this is all reporting back to these, TransUnion and those other credit reporting agencies. So it should only be the medical debt on those credit cards that are reported back.
And the credit card company can discern what's medical debt and what isn't?
They should be able to discern what's medical debt, what isn't. Just like right now, you may have rewards points on your credit cards, and you get like 3x rewards for eating out, but only 1x for like gas. So they can identify what's what.
I would just add that this would align with the bills that are moving that are also defining medical debt. The proponents of this amendment also contend that when someone is purchasing medical debt from a credit card, they do not know what sort of debt that is, particularly if you're making a purchase, say, at Costco pharmacy versus Costco regular or CVS, where your medical costs and your other ancillary costs are mixed, is what was presented to us on this amendment.
Well, I'm going to ask to hold the bill until we get this figured out, because I think it's too important.
Yeah, my question, Madam Chair.
Was very similar to Senator Lamb's on this issue. Did it come, it didn't come over to the House with that, correct? The House did not have that.
No, the House did not have that. There are two other bills that are moving that relate to medical debt. Another one that has already passed defines medical debt and uses this definition.
And they use this the solely definition or the specific,
The solely.
the solely definition?
So, Madam Chair, just so I fully understand, it appears the question is, can the medical-only portion be determined, is that, do we have anyone from one of the, I don't know, like the banks or a source for that information so that we could get a clear understanding of what might be?
I can have a source from the credit reporting agencies, but not here presently. That's why I asked to hold the bill.
Got it. Thank you,
Thank
Madam
you.
Chair.
We're going to move down to Senate Bill 671, which requires the Office of Cemetery Oversight to consult with the Departments of Health, Labor, and the Environment to conduct a comprehensive study of the public health and environmental impacts from the death care and funeral practices in the state. You do have a reprint. It's with amendments offered by the chair at the request of the Maryland Department of the Environment. The amendments appear at page 4 and simply delay the dates by which the office must submit its reports. From December 1, 2025 till July 1, 2026, and from July, for the interim report and for the final report from July 1, 2026 until January 1, 2027.
Senator Hayes?
Yes, Madam Chair. There were several other pieces of several pieces of testimony that made recommendations for other members. One of which was the Maryland State Funeral Home Directors, who are the industry experts. Is there any reason why they weren't included?
I did not see that amendment, Senator.
It's in the committee testimony.
Is it on this bill? There have been so many cemeteries.
Yeah, Senate Bill 671. Yeah, it's from the Maryland State Funeral Home Directors. They identify themselves, like they're the largest organization that represent people from the industry. It's in our bill folder as far as the testimony.
I didn't see it. I missed it. I must have missed it. So if that's something we want to consider adding, we can do it either verbally or we can hold the bill and I can amend it.
Yeah, and then in addition to that, there's two. It seems like the composition of it is kind of lopsided. They have the Green Council and the Maryland Green Burial Association. You look at their board of directors, they definitely lack a lot of diversity, but they also seem to serve the same purpose.
So these are just, the study, it's not creating a work group per se, it's the study is being done by OCO and they must consult with people and they can solicit input from. These are examples, they're not limitations on who they can solicit input from.
You're correct, I stand corrected. So it says specifically in the bill on page 3, lines 18 through 25, that they should, it names the groups for which they should solicit input, is the Green Burial Council, the Coalition to Protect Maryland Burial Sites, the Funeral. I think we should just hold it. I have a couple of amendments I want to massage this a little bit more. Thank you.
For amendments. Okay. Next, we have Senate Bill 928 and House Bill 267.
Senate Bill 928 and House Bill 267 are in the same posture. Generally, they prohibit, except as authorized under federal law, a person that is not accredited by the U.S. Department of Veterans Affairs from receiving compensation for preparing, presenting, or prosecuting a veterans matter, or advising, consulting, or assisting an individual with regard to a veterans matter.
Senator Reedy?
Madam Chair, I had been trying to work on the ideas for this bill, and I have an amendment that I've been discussing with some folks, and I wonder if we could hold this so we can discuss the amendment and figure out if it's appropriate.
We'll hold it to the next voting session.
Thank you.
Okay, House Bill 46. is a departmental bill that, as amended, is identical to Senate Bill 222, which passed the Senate unanimously earlier this session. The bill adds a representative of the Motor Vehicle Administration to the membership for the Cannabis Public Health Advisory Council. And by amendment, I did not give you a reprint of this, I don't believe, because it was an amendment just to make it identical to the Senate bill. But the amendment just adds a representative from the Office of Social Equity as a member for the council. There's no fiscal impact and no opposition.
Have we already passed the Senate bill?
Yes, there was a cross-file on this Senate Bill 222, which passed the Senate unanimously very early on in session.
Okay, so will they have to amend it, or we're?
We amended it in the Senate, so they have the amended version. They're keeping the amended on, and we're adding the amendment to the House.
Okay, so can I have Senator Hayes moved favorable with amendment, Senator Mounts seconded, all in favor of House Bill 46 with the amendment, as amended? Senator Guile?
Oh, yes, I'm sorry.
Thank you. Unanimous vote.
House Bill 799 establishes the Maryland Innovation and Initiative Institution Partnership Extension Program. The extension program is implemented and administered by the initiative, which already exists within TEDCO. The purpose of the extension program is to expand opportunities at eligible institutions for technology validation, entrepreneurial development, and industry engagement. Eligible institutions include Bowie State, Frostburg State, and any other public or private nonprofit institution of higher education deemed eligible by the initiative. Each institution must provide a cash match equivalent to 10% of the amount awarded under the program. There are no amendments, there's no opposition at the committee hearing, and this bill does not alter any funding that already exists for the program. It just expands how they can use the funding.
Thank you, Senator Kramer. Do I have a second? Oh, okay, can I get a second, and then we'll do the question, just because we're in the middle of it. Senator Kramer moved favorable. Do I have a second? Senator Jackson. Okay. Senator, what's your question, please?
I just was reading the testimony. Frostburg testified in support with amendment. And I was wondering if that was addressed.
The analyst is checking.
I do not have support with amendment. I just have a letter of support dated March 25th, 2025. Yeah, that's what I'm.
It may just be listed incorrectly when they signed up to testify. It just says favorable.
That's
with amendment.
possible. The letter I have here is in support, and there are no amendments suggested.
We have a motion and a second on Senate Bill 799 as amended.
No amendments.
No amendments, 799 without amendments. Senator Ellis, who's the second? I'm sorry, we did that. We're just voting. I'm sorry. It's easy to get lost. Okay, everybody in favor of House Bill 799? Unanimous vote, thank you.
House Bill 956 establishes the work group on artificial intelligence implementation to monitor issues and make recommendations related to AI, including the regulation of developers and deployers and implementation of consumer protections. The work group must report its findings and recommendations annually each year on July 1, beginning in 2026. You do have a reprint in front of you, which alters the membership and the staffing for the work group and authorizes the governor to include an annual appropriation to the fund, to the work group. However, while we were having bill hearings, I did receive an additional amendment from Senator Hester that is not reflected in this reprint.
Do we have a copy of that amendment?
There is one electronically in my email that I received while we were doing hearings about 30 minutes ago.
So I know that Senator Hester was working on this today, so if we can hold it to the next voting session, I would appreciate it. Thank you.
Madam Chair, just, do you know when next voting session is?
Probably tomorrow.
Okay.
At least one, if you give us time. It depends how long we're on the
Need to know
floor.
how to adjust my floor schedule.
Depends on how long Senator Hershey just Yeah,
Just checking. Just gonna make sure I accommodate everyone.
just saying and stuff.
House Bill 1018 is the last bill on this page of the voting list, but it's similar to Senate Bill 689, which passed the Senate unanimously earlier this session. House Bill 1018 requires banking institutions, credit unions, and mortgage lenders to include a provision in all conventional home mortgage loans that allows any of the existing borrowers to purchase the property interests of other borrowers in the event of a divorce. The affected financial institutions must disclose the assumption provision in writing to a loan applicant before the completion of the loan application. The bill's provisions apply. This is where the two bills will differ. The Senate bill that we sent over to the House, we removed the retroactivity provision. The committee in the House is very adamant that the retroactivity needs to be on there, so we added some language to the retroactivity, which you can find in your reprint at page 7. So while Section 1 of the Act would be retroactive, there is a clause specifying that it must be pursuant to a decree of absolute divorce that is entered on or after the effective date of the Act. So the retroactivity doesn't apply to divorces that have already happened or any loans that were already tried to be assumed. It's just moving forward, but it applies to mortgages already in existence.
Motion for House Bill 1018. Thank you, Senator Jackson. Do I have a second? Senator Gao? This is the cross of your bill.
Yes.
Thank you.
She said, I speak even when I don't.
All in favor of House Bill 1018 as amended? Senate Bill 1018 as amended. Do I have everybody? Senator Hershey? Okay. Unanimous. Are we going to also do Senate Bill 689, or we already did?
We have already done 689. The House is similarly going to add the clause to the retroactivity language that was reflected in this reprint. On page 2, we're going to move to House Bill 1021, which prohibits the State Commission of Real Estate Appraisers, appraisal management companies, and home inspectors from requiring an applicant to hold a bachelor's degree or higher to qualify for licensure as a real estate appraiser. A bachelor's degree is not currently required to become a licensed real estate appraiser, so it's in line with current law for that. The commission is also prohibited from requiring an applicant to hold a bachelor's degree for certification as a residential real estate appraiser. And again, a bachelor's degree is not currently required to become a licensed real estate appraiser. However, there are examination and other eligibility requirements that may be met by holding a bachelor's degree or higher.
So there's no cross-file on this? It sounds so familiar.
There is no cross-file on this. We did do a sunset extension for the commission that we discussed, but this bill did not have a cross-file. We heard it recently, though. There are no amendments and no fiscal impact.
Motion for House Bill 1021. Senator Hayes, second. Senator Ellis, thank you. All in favor of House Bill 1021? No amendments. Thank you. Unanimous.
And House Bill 1046, Delegate Bagnall, House Bill 1046 prohibits a mechanical repair contract from containing a provision excluding coverage for an issue with a motor vehicle identified in a technical service bulletin and prohibits a guarantor or provider from denying a mechanical repair contract claim because the claim was made for an issue that is identified in a technical service bulletin.
I just as we started to vote, received a text, there's a technical amendment needed on this bill, so if we can hold it for that amendment, I appreciate it.
I don't have the amendment, but. Yeah. House Bill 1310, as amended, generally alters the prescription drug repository program to authorize out-of-state pharmacies to participate in the program as a drop-off site or repository if they're approved by the State Board of Pharmacy, and expands the program to over-the-counter drugs and medical devices. House Bill 1310 also defines an eligible patient for purposes of participating in the program as an individual who, through self-attestation, is indigent, uninsured, underinsured, or enrolled in a public health benefits program, rather than the patient qualifying for the program as a needy patient as indicated by the person's healthcare practitioner. You do have a reprint before you. There are several amendments that are offered by the bill's House sponsor, and they address all opposition on the bill. It does everything that was described, that was the bill as amended, but on page 2, you'll see an expansion of the program to over-the-counter drugs and medical supplies, and you're gonna see over-the-counter inserted pretty much everywhere throughout the bill as conforming amendments. At line 11, you'll see the definition for an eligible patient, and that's for the purposes of accessing medications through the program. And then at line 17 is expansion of the program to pharmacies out of state. You're gonna see conforming amendments to that throughout. And at the bottom of page 2 over to page 3, there's a definition for tamper evident packaging being added for the purposes of identifying medications that would qualify under the program to ensure that they have not been adulterated. So page 3, a whole bunch of conforming amendments. At the bottom, there's an alteration to the expiration date requirements, both for accepting and dispensing a drug. So if a drug is less than 90 days from the date the drug is donated, or an over-the-counter drug is in high demand, the program can accept it, but must make certain determinations before dispensing it, such as that the expiration date doesn't occur during the time for which the prescription drug is prescribed. Additional clarifying and conforming amendments on page 4. And then amendments also further require the board approval for participating for out-of-state pharmacies. There's additional regulations related to the participation of out-of-state pharmacies at page 6, and regulation of the movement of donated drugs among participants that's being expanded. And for the most part, the rest is just conforming to amendments that I've already discussed.
I saw Senator Reedy first.
Also, Dr. York is in the gallery, should there be any questions beyond my expertise to answer.
Well, I'm looking at this bill, and I'm certainly not against people donating unused drugs to help people. That's great. We got a program. Number one, why would an out-of-state pharmacy be? So this is so people can drive to Pennsylvania and give their drugs away, or is this some state, it's licensed in Pennsylvania and they have an outpost in Maryland? Is that what we're getting at?
It's so that those, and Dr. York may be able to opine further, but it's so that the out-of-state pharmacies may accept those drugs and be a repository, and then they can transfer amongst participants in the program. So they can transfer those to a pharmacy in Maryland so that Maryland patients can access them.
So is this people in Pennsylvania? I'm just using Pennsylvania because I live near Pennsylvania. People in Pennsylvania could give their drugs away to a Pennsylvania pharmacy that might want to enroll in giving the drugs into Maryland? And then there's one thing that actually annoys me about this bill, which I'll get to in a minute. It has nothing to do with what I just asked. So I'd like to ask one more thing or say one more thing. But yes.
Let's see what Dr.
What this bill does.
Yes, thank you for the question. So the way the program works is we have a current repository program in Maryland that is exclusive to Maryland pharmacies. Maryland patients walk into their independent pharmacy, drop drugs off in the repository, and then they are dispensed amongst patients. There's out-of-state entities that are much larger, and when you have a donation program like this, scale is very important. So now what can happen is you have an out-of-state pharmacy that registers as a, I think they're called a non-resident pharmacy, and then they can enlist in the repository programs. So Maryland patients can go to this online out-of-state pharmacy and order low-cost drugs to be donated into the state.
Okay. Thank you, I think.
Yeah.
Yeah. So this is about online pharmacies?
It's
Let me ask this, is Walgreens a Maryland pharmacy even though its corporate headquarters are not in Maryland?
each individual site has to be licensed in the state, though I guess it gets a little technical with like a major chain pharmacy. They'll usually probably have one out-of-state pharmacy that does mail order or something like that. In this case, there is a single entity, it's called Serum, that is partnered with a pharmacy in Georgia. So Maryland patients would go online order, which is very common. We have a number of out-of-state pharmacies that can ship into the state. And they would order from the online pharmacy Good Pill to get low-cost medications.
Okay. Then my thing that really annoys me about this bill is why is there a fiscal note that says we have to spend $50,000 or $60,000 more a year on another person just to do this? It feels like it's just, we've been talking budget all day. It's like annoying me, and I'm not mad at you. I'm just annoyed.
Dr.
So-
York? Can you
Yeah,
explain
we would
fiscal-
defer to the Board of Pharmacy. It was, I think, their fiscal note. I think when you have an expansion of a program, even though they have folks that are monitoring out-of-state pharmacies, I think they said they might need an extra FTE specifically for this program. I defer to them, though. We were able to work with them to find efficiencies in their original fiscal note.
Okay.
Okay,
Can I make a motion?
not yet.
And this, I would just add, Senator Reedy, the note does not reflect the bill as amendment because all of these bills are being added on the House bill in the Senate, so we don't have a revised.
It sounded like
note.
there was a lot more things getting added into the bill.
Basically, the whole bill was struck and rewritten, so the note is not reflective of necessarily, and the board did come in opposed initially. These amendments address their opposition. The pharmacy board
Oh,
came
wait,
in
so the
opposed.
pharmacy board doesn't even want to do this?
Initially, they were opposed with how the out-of-state pharmacies and being able to regulate these amendments have addressed that opposition.
I might have a motion later, Madam Chair.
Okay, Senator Jackson, questions?
Yes. So when someone donates like their prescription, what happens to that? Do they have to remove the label? Like, how is that information protected?
The way this program works is it usually works with very high volume systems. So like a hospital or a nursing home that just has a huge stock of drugs. As those drugs get close to expiration, instead of just burning them as medical waste, they donate them to a repository program, and then the repository program can then distribute those medications to patients that can use them.
So this is just hospitals donating, not like individuals?
I would say the Maryland repository program probably takes prescriptions from individuals. That's why it's a much smaller scale. This one is generally partnerships with much larger organizations.
Okay.
Yeah.
Okay. Thank you.
Senator Hayes?
Thank you, Madam Chair. I think, one of the good things about this committee, learn new things all the time. I had no idea that this drug repository even existed, but I get it, and I kind of like it, because I think it gives an opportunity for individuals. Does it lower the cost? I would assume, since
They are distributed at nominal cost. Because this is an out-of-state pharmacy, there is kind of a shipping cost, but it's very low. I think they.
Right, but the same for in-state as well. It lowers the
Correct.
cost. And so I like that idea, instead of people throwing very useful medications away, that another patient that need it can benefit from it or whatever. And I was concerned originally during the hearing that the Board of Pharmacy had opposition to it, but I see that one of the amendments to satisfy the Board of Pharmacy was, in order for organizations to participate, they need to be approved by the Board of Pharmacy. And so I think that gives sufficient safeguards. One of the things that concern me, though, it seems like this now goes beyond pharmaceuticals. It now includes medical supplies, which wasn't a part of any hearing, part of any conversation or whatever. So I'm kind of curious, does anyone have knowledge of where that might have come from?
I think I can provide some general background context. I think the intention of the sponsor of the bill on the House side was actually to have this reprint before you when he was testifying the first time. So these changes have always been intended to be included for the version that came to the Senate. And all of those amendments, there were 2 letters of support with amendments, and they were referring to these amendments in this reprint. So the Board of Pharmacy, for example, did a letter of intent, or sorry, a letter of support with an amendment, and then Serum, the out-of-state pharmacy organization, also submitted a letter of intent with amendments. They were referring to the fact that the bill that you had needed to be amended with these amendments before they would support it. But these are all.
Did they allude to supplies, though?
That's correct. I think that's also included in the current repository program.
That is current law, that the medical supplies can be accepted and
already
donated.
in-
Yeah,
in Maryland.
yeah, what the bill is adding is the over-the-counter drugs. They have not previously accepted those, but now that is the expansion portion.
No, that's helpful. I guess my concern was we're expanding the scope without a public testimony, a public airing of it to give people an opportunity to weigh in, but if it's already there, it makes sense. Thank you. Thank you, Madam Chair.
Thank you. Senator Ellis?
Madam Chair, I have a quick question. Can someone donate medical marijuana in the repository?
I'm pretty sure the answer to that is no.
Okay. We say no. I mean, you get that with a prescription, right?
You have, so medical cannabis is treated differently than all other prescription medication in this state. It's not a prescription that you get, but you get a certification from your doctor, and then you can only purchase it through the dispensaries. You can't go to your local pharmacy, for instance, and get cannabis. So it's treated and segregated from the rest of the drug market.
That wouldn't be allowed to enter the.
No.
This bill. Okay, great. Thank you.
Thank you. I see our cannabis guru here in the audience, too. He could confirm that, but sounds accurate? That's correct. Thank you, Will. I was thinking about when my dad was in the nursing home, all of his medications were in these bubble packs. And so he passed away like on the 9th of the month, so it would have been another 3 weeks of medication safely so something like that could be donated because they're in bubble packs and they're, okay.
Exactly.
It was a lot of medication. Thank you. Any other questions for Dr. York? Thank you, Dr. York. Do I have a motion favorable for this amended bill?
Move favorable with the amendment.
Thank you, Senator Hayes. Do I have a second?
Second.
Senator Guile. All in favor of the amended bill 1310. All right, Kenny, can you call the roll, please?
House Bill 1310, favorable with amendment. Vice Chair Hayes?
Yes.
Yes. Senator Kramer?
Yes.
Yes. Senator Reedy?
I don't want to add more costs right now, so no.
No. Senator Ellis?
I'm just concerned about contamination of medicines and supply. I know when years back, the Tylenol scare and stuff like that. I'm just really leery of anyone touching a prescription outside of our authorized system, getting back in the system for anyone. So I'm voting no on this bill.
Senator Mouts, no. No. Senator Jackson, no. Senator Guile?
Yes.
Yes. Senator Lamb?
Yes.
Yes. Senator Hershey?
Nope.
No. Madam Chair?
Yes.
Yes. 5-5. 5-5.
Okay, next one is House Bill 1494. This is a local alcoholic beverages bill. Establishes the Class MT movie theater beer, wine, and liquor license in Howard County, authorizing the license holder to sell beer, wine, and liquor at retail at a place described in the license for on-premises consumption by a patron who has purchased a ticket to a current or future showing of a movie on the premises. There are no committee amendments. There is no opposition at the committee hearing. There is a letter of support from the Howard County Senate delegation. And also not on your list, but we did just receive in a re-referral is Senate Bill 1019, which as amended is identical to House Bill 1494.
Motion favorable on 1494.
Second.
Senator Hayes.
Howard County. Whatever you need.
All in favor of House Bill 1494 as amended?
House Bill 1494 is just favorable. There are no
As
amendments.
favorable, no amendments. House Bill 1494. Can I have a vote? Unanimous vote, thank you.
And then if we may take up Senate Bill 1019, it is identical to House Bill 1494. It was just sent over to the Finance Committee from Senate Rules. This would be motion favorable as amended would be appropriate. It was amended to match the House bill.
Okay, Senator Mounts, Senator Guile, all in favor of the Senate bill? Thank you.
And the last bill with my name next to it is going to be House Bill 1516. This is an emergency bill and is similar to Senate Bill 1026, which passed the Senate unanimously earlier this session. As amended, House Bill 1516 generally exempts from state licensure requirements requirements for installment loan lenders and mortgage lenders. A passive trust that simply acquires a mortgage loan but does not make loans, is not a mortgage broker or servicer, and does not engage in servicing mortgage loans. The bill also establishes the Maryland Licensing Work Group, staffed by the Office of Financial Regulation, to study and make recommendations on licensing requirements for persons that provide financial services in the state. The work group must submit its recommendations by December 31, 2025. You do have a reprint in front of you. Largely, the amendment strike the bill as introduced. It was upon further analysis and reading, the scope of the bill as introduced was much broader than intended. So this, the amendments really just narrowed the scope to exempt specifically passive trust from installment loan licensure requirements. And there's that's at the bottom of page 2. On page 3 of the reprint, there's a definition for a passive trust. And that's for the purpose of exempting a passive trust. That's just what qualifies. On page 4, there's an additional exclusion for certain federal government trusts from the requirement to be licensed as a mortgage lender. Page 5 is just conforming with the exemption of the passive trust from mortgage lender licensing requirements. Page 6 increases the number of consumer advocacy representatives on the licensing work group. And page 7 adds intent language, which was on the Senate bill as it passed the Senate earlier this session. There's no fiscal impact.
So there are a lot of amendments. This bill came from the administration. It was late, and that was why I sponsored at the request of the administration as well as Delegate Queen, because it was obviously too late to come through the process. So the administration has created all the amendments and tried to really narrow it so it's just passive trust.
Correct.
It's not second mortgages or zombie mortgages. It's just passive trusts.
Really seems I like it.
We already voted for it, yeah, please.
In concept, it was the same bill. This is just making sure it applies specifically to passive trust. Before, the bill was a little bit broader and captured entities not intended to be captured.
It's two new amendments.
Yeah, I heard that. Thank you for making sure I knew that. But I did hear you say it. We were a little curious that there were a lot of votes in the House against it, and that doesn't matter for the purposes of discussing the policy, but was just sort of curious. So I'm assuming I don't quite understand it, because we're trying to be sure that these are like trust actions that were never before in the history of mankind in the modern era, were these ever considered to be mortgages for the sake, right? And
They
so
were
now-
never required to be licensed in the past. This came
Right.
about through a court decision, which indicated that the passive trust must be licensed, which led to regulations from the Office of Financial Regulation coming out. And many businesses, at least 6 mortgage lenders, stopped lending in the state,
Right.
waiting
So
for this bill.
made-
So this
made it-
bill's addressing that.
Made it harder to get competitive good mortgage lending rates, correct? And, all right. No other state does it that way. And there were concerns from some about, when it was broader, about whether it got into messing with some of what was done nationally back during the Great Recession, but it doesn't do that either, because it's just about trust. Okay, so
Correct.
I remain supportive.
Thank you. So you have a motion.
Second.
Senator Reedy and Senator Hayes, all in favor of House Bill 1516 as amended? Now the unanimous vote. Thank you.
It's been amended, hopefully, more better than.
Next on the list is Senate Bill.
Okay, let's hear from Nathan.
Next on the list is Senate Bill 696. So this is the bill that deals with pediatric hospital overstay patients, and it's something that the chair has been working on throughout session. So broadly, Senate Bill 696 requires the Department of Health, in coordination with the Department of Human Services, to ensure that a pediatric hospital overstay patient is transferred and treated in the least restrictive setting when clinically indicated and possible. So the bill further requires that the Department of Health and the Department of Human Services establish a pediatric hospital overstay coordinator in each department to, among other things, advocate on behalf of pediatric hospital overstay patients. The bill also specifies that the Maryland Mental Health and Substance Use Disorder Registry and Referral System includes both private and state inpatient and outpatient mental health and substance use services, and then authorizes a hospital to concurrently explore in-state and out-of-state placement options for an overstay patient. Currently, they have to explore in-state first before moving on to the out-of-state, is my understanding. So the amendments strike provisions establishing a single hospital overstay coordinator in the Governor's Office of Children, and then implements the 2 coordinators in the respective agencies as I've described. The amendments also establish additional requirements related to patient transfers and establishes a work group on children in unlicensed settings and pediatric hospital overstay in the state. The children in unlicensed settings is referring to Department of Human Services, well, a practice in which children are housed in hotels or motels with one-on-one supervision. And so this work group would examine that practice as well as the practice of pediatric hospital overstay patients and report back with specific recommendations with amendments.
Are you seconding?
You know, can we hold this for one day?
No.
All right. So I get it. This is a very important issue. I work with these people every day. There's a lot of nuances to it. This is the first time I've seen the amendments. And so I wanted to hold it at least one day to have a chance to talk to people that actually do this work. But otherwise, I won't be able to.
You can hold it, and I will send the Chair of Health and Government to you when she calls me.
Yeah, just for one day. I just want to be able to see it.
Okay.
For tomorrow.
Okay.
Okay, up next, actually, the next 4 bills sort of occur in pairs, where there is a House bill and a Senate bill. In each of these cases, there will be, well, there's a lot of amendments, and I'll explain it pretty much as we go. So House Bill 19, up first, is a departmental bill that the number one thing that it does is it extends the Board of Nursing for 5 years to July 1, 2030. Beyond that, the bill extends the authority of the Secretary of Health over board infrastructure operations. It extends the termination dates for specified preceptorship income tax credit programs. The bill expands eligibility under the Maryland Loan assistance repayment program for nurses and nursing support staff. If you'll recall from the hearing, leaving nursing support staff in this program and including them in the expansion was something that was requested. The amendments do that. The bill also lowers the rotation hour requirement from 100 hours to 90 hours for nurse preceptorship income tax credit programs. That was also something that was requested. And then the bill as amended also authorizes the use of Board of Nursing special funds for infrastructure operations. This is conforming with the provision in the BRFA. So while the secretary still has authority over those matters, the special fund may now be used for that again. The House added an amendment delaying the implementation of a 2024 bill that the chair worked on that dealt with geriatric nursing assistants, and it delayed the implementation of that bill by 1 year. The chair worked it out with the Hospital Association and the Board of Nursing to amend that 1 year delay down to 6 months. And then the bill includes some conforming changes to dates that were otherwise in statute related to that CNA, GNA program.
And if you think you've been hearing that CNA, GNA program for a number of years, you have. That's why I got them from 1 year back to 6 months. It's time. Do I have a motion for House Bill 19?
Favorable with amendments, yes.
Favorable with amendment.
Move favorable as amended.
Senator Hayes and Senator Ellis. Okay, go ahead.
This question's for council. I'm just trying to skim the bill real quick here.
Yep.
This doesn't have, I guess the title mentioned sunset extension. This doesn't affect the standard, how these health occupations boards are usually on a sunset extension and such. Does that affect this, or this does?
The Board of Nursing is extended for 5 years, from 2025 to 2030.
In this bill? In this bill?
Yes. It extends the termination date of the board for 5 years.
I know there were a lot of issues with the Board of Nursing.
Yes.
5 years just seems like a long time to give them an extension on a sunset extension that has had issues before. I think last time when we considered this, we actually intentionally gave them a shorter sunset extension. And I know that the prior Secretary of Health was looking at, kind of a relook of all the health occupations boards.
Yeah, so I spoke to the Department of Health, and there is not, let me put it this way. The Department of Health has been using legislation that has been introduced over the last couple of years to address concerns that were raised with these health occupation boards as part of that broader examination that occurred. I think it kicked off like the last year or the year before. But with respect to the Board of Nursing, there have been significant changes made, and the Secretary of Health remains responsible for the infrastructure operations of the board, which was sort of the primary concern with the Board of Nursing. The last time the board came up for sunset renewal, and this committee was dealing with those issues. And so it's I would say the opinion, because this is a departmental bill, it was the opinion of the department that the Board of Nursing is ready for a 5-year extension, keeping in mind that the secretary remains involved in those, in the activities of the board.
Well, we also have a new secretary that's come in since this bill was introduced under the prior secretary.
That's true.
Is there any updated opinion from the current secretary?
The department did not seek a reduction in the extension of the Board of Nursing by amendment as part of this. I know that they were heavily involved in the amendments that were considered and adopted in the House.
Can I hold this just to check with the department on this?
Absolutely, and if you don't like the answer and want to amend it, just bring an amendment back. We'll hold it.
Okay, so that would hold 216 as well. So bringing up House Bill 502, this is an administration bill that establishes the Office for Disability Employment Advancement and Policy, or ODEP, in the Department of Disabilities to, among other things, implement the Maryland as a Model Employer Initiative. The office is responsible for the implementation and oversight of the initiative more broadly. By December 1 of 2026, and then annually thereafter, the office has to submit an annual report to the governor and the General Assembly on the progress and outcomes of the initiative and recommendations developed by the initiative to continue the improvement of state government employment practices for people with disabilities. So that's what's really at the core of the bill, state employment practices for individuals with disabilities. So then the Secretary of Disabilities may adopt regulations to implement the bill, and the bill may not be construed to establish an entitlement program. So the amendment specifies that beginning in fiscal year 2027, the governor may include an appropriation of $250,000 in the annual budget. That language is only authorizing, it's not a mandate, but the governor is able to include more funding as the governor believes appropriate.
The reason it took so long to get on the voting list is it had a $1.2 million, and it was reduced to $250,000. Can I do Senator Hayes first?
I just have a quick question. Nathan, are we allowed to co-sponsor the Senate version of these bills? Okay. All right. I want to add that as an amendment to co-sponsor to the Senate version.
Because they did it in the House.
Oh.
Senator Hershey?
Thank you, Madam Chair. So following up on your statement, how was the fiscal note reduced?
Well, what I'll say is that the inclusion of the authorization for $250,000, I believe the way the budget committees are sort of looking at this is that sort of pegs expectations for the kind of funding that can be included, because obviously the budget committees could make changes to whatever the governor puts in their budget. So it would, were the office to receive only $250,000, the activities of the office would be significantly reduced in line with the funding that they had available to them.
That's what I was thinking was going to be said. So
Yeah.
we're passing the bill in its entirety, and then we just said, but instead of giving you the $1.3 million that you need to enact the entire bill to do what the bill says, we're only going to give you $250 and you do what you want?
Or it's to the governor and the budget committees to increase that number. Based on the budget constraints this year, this was the instruction that was received.
Okay, thank you.
Move favorable with amendment.
Senator Hayes, who's the second? I need a second. Senator Guile? Okay. All in favor of, first we'll do House Bill 502 as amended.
Yeah.
Tammy, you need to call the roll.
House Bill 502 favorable with amendment. Vice Chair Hayes?
Yes.
Yes. Senator Kramer?
Yes.
Yes. Senator Ellis?
Yes.
Yes. Senator Mounts?
No.
No. Senator Jackson? Yes. Senator Washington?
Yes.
Yes. Senator Guile? Yes. Senator Lamb? Yes. Senator Hershey?
I think that's fine.
No. Madam Chair?
Yes.
Yes.
Move favorable on Senate Bill 433.
Okay, can we have the same vote to count for both 502 and Senate Bill 433? Thank you. Tammy, you got that?
Great. Okay. Up next is House Bill 783, which expands the scope of required training for individuals licensed or certified by a health occupations board to include implicit bias and structural racism. Applicants for the renewal of a license or certificate must attest to completion of approved implicit bias and structural racism training programming the first time they renew after April 1st, 2026. The Cultural Linguistic Healthcare Professional Competency Program in coordination with the Office of Minority Health and Health Disparities must identify and improve implicit bias and structural racism training programs. Each health occupations board may adopt regulations allowing an applicant for renewal to receive continuing education credits for completing an implicit bias and structural racism training program. There are no amendments on the House bill.
Thank you, Senator Guile. Do I have a second?
Second.
Senator Hayes. All in favor of House Bill 783?
Question, please.
Senator Hershey?
just seeing that the major part of the bill was structural racism training, the definition of the major part of the bill got changed.
Yeah, that was at the request of the Department of Health. This is the definition that they use in other contexts, is my understanding.
Well, I looked at their letter, I guess letter of support with amendments. Is that's the amendment that they got, they put on. So that came from where? Just,
I'm pulling up the, yeah, so it is the language that is requested in the favorable with amendment support. The department,
I thought you said they use it somewhere else.
that was my, yes, that was my understanding, but I'm looking for the specific reference in the letter. Let's see, understanding, structure, but suggest an amendment to assist with implementation, the definition outlined in the bill, it references that, to ensure the definition is easily understandable and accessible, the department suggests replacing the definition with one developed by the American Medical Association.
Okay.
So, so it's the definition that was developed by the American Medical Association, because that's what my understanding is the department looks to in other contexts.
I understand. Thank you very much.
Senator Reedy?
We did implicit bias a few years ago, and I understand the nexus of implicit bias. You want to be sure that health, I mean, at least in theory, you want to be sure that somebody in a health occupation doesn't have, is aware of the fact that we all can have some unconscious bias in different areas. I never liked the word implicit, but I thought unconscious is actually a better word, but that's a different issue. This structural racism definition reads to me like, you know, a sociology, political science textbook, and these are health occupations. So I get the implicit bias idea as to why that might be something we would require. This is requiring now that you be licensed or that you be undergoing something about the totality of ways in which societies foster racial discrimination by mutually reinforcing systems of housing, education, employment, earnings, benefits, credit, media, healthcare, and criminal justice. So is this going to require that for somebody to get a health occupation in this state, they have to enroll in a class or classes that tell them that America basically is mutually reinforcing all these systems all together? I mean, this is a pretty comprehensive and pretty controversial way of looking at it all. I mean, to say a history of understand America's history of slavery or America's history of racial discrimination, because we have that, we have stuff in our history. I could even sort of understand it, but this is like, or is this saying we're going to study all the nations of the world and how they mutually reinforce? There have been histories of mutually reinforcing systems of housing, education, employment, earnings, benefits, like in India's caste system or something, because America's not doing this. We're not. We're not mutually reinforcing implicit racial bias, structural racism. Structural racism is a strong word. So I just want to put that on the record. I think I know the direction of this General Assembly is going to just pass this, but I'm just saying, this is very strong language. This comes out of like, I don't know, Howard Zinn type textbook of, the history of the American West, or something. I mean, it's like, it's pretty ridiculous. I'm just going to be honest, ridiculous. Again, I understand the idea that you want to have some training in unconscious bias or even things like implicit bias. I can see why that might be a nexus there, because anybody that's helping someone in their healthcare needs to understand their culture and where they come from and some of the things that come from that. But why does your healthcare professional need to understand the history of discrimination in housing and education? Actually, I even understand the history. This is speaking of as if it is active today. So I'm going to be voting no on this bill.
Senator Kyle?
I was just going to offer this, that The funding for this program is through a grant from the Maryland Nurses Association. If this helps with, to assuage any of the concerns that may be raised here.
Did you hold it?
So there was a
You didn't hold it.
motion favorable on the House bill by Senator Guile, seconded by Senator Hayes.
Okay.
But if you want to hold the bill.
Well, Senator Ellis has a question. Let's hear this question since we're this far.
Yeah, thank you, Madam Chair. It's not necessarily a question, but it's a comment to but to talk about some of the stuff that Senator Reedy talked about. So, talking about racism, talking about the structural, think about how Africans arrived in this country, in this state. We didn't come over on the Mayflower or the New World. Came over, and my ancestors in Jamaica, same way, and on ships, Middle Passage, millions died coming over. Hundreds of years of slavery, and after that, laws that said we couldn't go in a lot of schools and professions, and all the way through now. And look at the in the healthcare area, the Tuskegee experimentation, where the government ran a experiment on black men and wouldn't cure them of diseases, to our own Crownsville Hospital here in Maryland, up the road from here, which we passed a bill on that. The government, whether state or federal, not to mention in the housing area, for so many hundreds of years, even for veterans coming back from World War II, black veterans couldn't get VA home loans because of redlining the government. So it's not individuals not being nice and just misguided. It's entire institutions, laws that deprive. And I think that's where the structural part comes in, where institutions, bureaucracies, they participated in depriving so many people of not just opportunities, but life, liberty, and even the pursuit of happiness. Stuff that the Constitution enshrined. So many Americans, particularly African Americans, couldn't even pursue happiness, because of governments that said, you can't take a case to court and we won't hear and listen to you. So that's the structural part that I think this bill is addressing, which we still are dealing with a lot of the after effects of in Maryland. So thank you, Madam Chair.
Thank you, Senator. Senator Hayes.
Thank you, Madam Chair. And I appreciate my colleagues' comments. I would just add on to what Senator Ellis said. When you talk about structural and systems, you're talking about institutions that have the authority to have an impact on a greater amount of people, right? And although we have made some advancements in many of our laws and many of our systems, there's many that will argue that some of the things that directly discriminated against people based on race there have been proxies put in their place. In a day when it used to be based off your race, now it's zip codes, right? Now it's your school district that you may live in, and so I get it. This is an uncomfortable conversation, oftentimes for individuals to engage in, but and I get it, but to say that it's not existing today, I would invite anybody to walk into the shoes of a black man here in America, and I would tell you that on any given day, we still are very much self-aware of, how we're treated. And so I think this bill, especially like with healthcare, it's a very intimate situation when you're dealing with healthcare providers. There's not many people that I take my clothes off for, other than my wife. But my healthcare provider would be one of those individuals, right? I'm just saying. And so you want to make sure that individuals that are sharing some of the most intimate, private, confidential moments in your life are respectful of the cultural significance in those moments. So that's what I'll add to this conversation.
Gentlemen, I appreciate all your comments. I truly do. We have talked about 19 bills and passed 8. It's 5 after 5. We have 25 minutes and another, 20 bills to go. So I think we should hold this discussion and go to another bill. Is that okay? Can we do that? Thank you. Let's go.
Okay, up next is House Bill 1142, which deals with the Maryland Interested Parties Advisory Group and the establishment of it. The bill generally codifies the federally required Maryland Interested Parties Advisory Group in the Maryland Department of Health to advise and consult on Medicaid payment rate sufficiency. There is an amendment. It's a technical one. It's on page 3. The House added the director of Medicaid. However, that addition is redundant of having the Deputy Secretary for Healthcare financing. So the amendment just removes that duplicative member. There is no fiscal impact. So a motion favorable with amendment would be appropriate.
Thank you, Senator Mounts. Do I have a second? Second, Senator Guile. All in favor of House Bill 1142 with no amendment, right?
As amended.
As amended. 1142 as amended. Do I have a, are we voting?
Yeah.
Okay. Unanimous with who's here, which is a 10 to 0.
And up next is Senate Bill 920, which generally codifies the Interested Party Advisory Committee, in addition to the tweak to the member, it aligns the Senate bill with the House bill that the committee just passed.
Senator Mounts, Senator Guile, all in favor? Senate bill? Okay,
Yes, as
unanimous
amended.
vote.
Okay. Up next, we've left the realm of the House bill, Senate bill cross-file situation. So House Bill 265 is identical to Senate Bill 456, which passed the Senate unanimously earlier this session. This is a bill where finance is second, EEE is primary. It expands eligibility to the Maryland Dent Care Program to include dentists and hygienists employed on a part-time basis. There are no amendments, so a motion favorable would be appropriate.
Do I have a motion favorable? Senator Guile, did you motion? Yes. Second? Senator Ellis?
Second.
Thank you. Okay, I think we need to call the roll call.
House Bill 265 favorable. Vice Chair Hayes?
Yeah.
Yes. Senator Kramer?
Yes.
Yes. Senator Reedy?
Yes.
Yes. Senator Ellis?
Yes.
Yes. Senator Mounts?
No.
No. Senator Jackson?
Yes.
Yes. Senator Washington?
Yes.
Yes. Senator Guile? Yes. Senator Lamb?
Yes.
Yes. Madam Chair?
Yes.
Yes. 9-1.
Okay, thank you. We have House Bill 406.
Yes, House Bill 406 requires the governor to appoint the hearing aid dispenser members of the State Board of Examiners of Audiologists, hearing aid dispensers, speech-language pathologists, and music therapists with the advice of the Secretary of Health from a list submitted by the Secretary, submitted to the Secretary and the Governor by the board instead of by a specific group. So the House substantially narrowed the bill, leaving only the changes to the appointment of the hearing aid dispenser member as discussed at the bill hearing. There are no amendments, there is no fiscal impact, there is no opposition. So a motion favorable would be appropriate.
All in favor? You said it was not amended?
No amendments.
No amendments. All in favor of House Bill 406? Senator Washington, you good? Senator Lamb, good, thank you.
House Bill 871 alters the definition of community benefit to include a community health worker workforce program between a nonprofit hospital and a community-based organization. So the purpose of a community health worker workforce program must be to provide services to patients of a nonprofit hospital that are intended to improve health outcomes and address social determinants of health. The amendments that are shown in the reprint before you offered by the chair authorize instead of require a partnership that establishes a community health worker workforce program to be executed through a memorandum of understanding. That's on page 4 in line 11. The House sponsor requested the amendment in testimony at the hearing.
Senator Ellis, favorable with amendment. Second, favorable with amendment. Senator Mounts. Okay, all in favor of House Bill 871 with amendments. Okay, unanimous vote.
Up next is House Bill 1053, which clarifies that a parent of a recipient of self-directed services must have the option to provide specified services to the recipient if the recipient chooses the parent to provide those services. So if a parent, family member, or legal guardian is providing services, then those services have to be authorized to be provided by the parent, family member, or legal guardian by a developmental disabilities waiver that is approved by CMS.
I haven't had a chance to talk with Dr. Moran yet. I'd like to hold this bill.
Very good.
Thank you.
Up next is House Bill 1066, which requires the Commission on Behavioral Health Care Treatment and Access to establish an additional work group on improvement of health, social, and economic outcomes related to substance use. The work group must make recommendations on changes to state law policies and practices. There are no amendments. There was no opposition at the hearing.
All in favor of, or motion favorable on House Bill 1066? Senator Guile, move favorable, and Senator Mounts second. All in favor of House Bill 1066 with no amendments? You're going to vote no. We need to call roll, Tammy.
House Bill 1066, favorable. Vice Chair Hayes?
Yes.
Yes. Senator Kramer?
Yes.
Yes. Senator Reedy?
No.
No. Senator Ellis?
Yes.
Yes. Senator Mounts? Yes. Senator Jackson? Yes. Senator Washington? Yes. Senator Guile? Yes. Senator Lamb? Yes. Senator Hershey?
No.
No. Madam Chair?
Yes,
Yes. 9-2.
thank you. Bill passes.
I believe House Bill 1104, Madam Chair, is to be held.
Yes, we have amendments coming.
All right, then there is House Bill 1244. So House Bill 1244, as amended and shown in the reprint, codifies the Maryland Developmental Disabilities Administration Waiver Advisory Council within DDA to advise and provide recommendations to the Developmental Disabilities Administration on system design, service delivery, and quality enhancement standards for Medicaid waiver programs operated by the administration. There are some amendments on pages 2 and 3. And so you'll note that they're offered by the chair and Senator Washington in one instance and Senator Hayes in another. So first, Senator Hayes' amendment starting on page 2 increase from 20 to 21, the number of individuals with lived experience participating in an administration program. And then that Senator Hayes' amendment also over on page 3 below line 20 adds one representative of the Maryland Council of Support Brokers. And then the chair and Senator Washington are also offering amendments that would, up top on page 3 in line 5, increase from 1 to 2 the number of coordination of community services providers, and then also under beneath line 20 add one representative from of Service Coordination Incorporated. Generally, there is no fiscal impact.
Okay. Motion favorable on the amended bill. Is there a second? Senator Reedy, are you motioning or you're asking questions?
I have one question.
Okay, yeah, go ahead.
I'm trying to be sure I understand, what does this bill do for the AHEAD model?
No, we've, this is 1244.
Oh, I was like looking at the wrong, I was like diving into the wrong bill. You held
Kamala's
it, you
got
held
some
it. I'm
amendments.
sorry, I
That's
was looking,
okay.
I started looking at it while you're
So we
talking.
have a motion favorable on 1244.
Question.
Do I have a second for Senate Bill, for House Bill 1244, Senator Hayes? I forgot who motioned. Who motioned favorable? Senator Washington, thank you. Okay, so all in favor of House Bill 1244 as amended? Okay. Unanimous vote? Thank you.
And then Senate Bill 1027 is the Senate cross-file of this bill. It was just assigned to the Finance Committee. It came out of rules. The committee could move favorable with amendments on Senate Bill 1027 that would conform the Senate bill. Senator Washington?
Senator Washington moved. Who seconded?
No one yet.
Senator Lamb? All in favor of Senate Bill 1027, same as 1244?
All right, on to Dave.
Dave's coming up. I'm going to hold 401 and 517. I heard from the Secretary of Transportation today, so we'll hold those two. You heard two?
401, 517.
Yeah.
Yes.
We're not
They're gonna
primary,
be
but
held.
David's going to do the amendments for us. All right, Dave, 1144.
Okay, 1144, House Bill 1144 requires the Maryland Transit Administration by June 1st, 2025 to convene a work group to create a rider code of conduct and implement a comprehensive internal safety program to strengthen protections for MTA operators and passengers. Until the rider code of conduct is adopted and the comprehensive internal safety program is implemented, a person who is alleged by a public transit operator to have committed an assault or other intentional act causing bodily injury to the operator or passenger while the person is on a public transit service or at a transit service station may be prohibited from using the transit service or entering a transit service station. You heard this bill the other day. There was no amendments offered. The bill had no opposition at the committee hearing, and there's no.
Favorable. This is to stop these people from getting mugged and then having the same people come right back in their faces and
No, I got a question. David said that there was no opposition, but I was wondering, in the bill file, there's something from the Office of the Public Defender.
Yes, they believe, they have a problem with this, keeping people off the trains.
Yeah, can we do that? Can we keep people off of public transportation?
Well, the way the bill is the way the bill is written, this section does not, a person who is alleged, it's pretty specific, a person who is alleged by a public transit operator to have committed an assault while the person is on board may be prohibited from using a state public transit service or entering under guidelines and subject to an appeals process established by the administration. So they may do it. It doesn't say they must do it or this person. So how this is actually going to be effectuated will be left to guidelines established by the administration. And once they come up with this, which was amended in by the House, once they come up with this plan, this section will go away from the law, and then the plan will take the place of how this is going to be dealt with when folks are attacked by, when passengers or operators are attacked by people while doing their job.
Right, so MDOT has a police department, right? So if they have guidelines that say that you're not allowed on there.
I don't believe MDOT has a police department.
Well, MTA has police.
Yes.
Yeah, they have a police department who's very, available. So if the guidelines say you can't come on there and then you still attempt to go get on public transportation, could you be arrested?
This is not in the criminal law article. This would be in the MTA. So I don't think there's
Nothing, because they're guidelines, there's nothing giving them the authority to arrest somebody based off of disobeying the guidelines. Can they be arrested for disobeying the lawful order of a police officer?
I would think so, yes, if the police officer is there. But this is just if the person recognizes the person, then they're trying to develop a process for this person not to be allowed to board these transit systems or walk into stations.
Right. And so there's no consideration for behavioral health issues, mental health issues, or?
I would assume, that when the group looks at these items in their, when they come up with a plan, I would imagine all these things would be considered in the plan. But it's a very broad, broad prohibition that uses the word may, not shall.
Right.
And
Yeah, I get it. And I'm tired of hearing constituents or, drivers or whatever to be assaulted. But at the same time, it's public transportation, so I'm not sure what our limits are or what we're actually giving them the ability to be. So, but it seems like a reasonable bill. I think this one, because there's been so many egregious attacks on the employees at MTA, I'd be, very interested in just monitoring what guidelines they come up with over the interim, and we could always make changes in the past. But thank you, David.
Senator Hayes and I are in the same place. It's all good. Did I move favorable or? Okay.
Second is Senator Ellis. Okay. All in favor of House Bill 1144 as amended, correct, David?
there's no amendment, no amendments to the House bill.
Okay, no amendments. So House Bill 1144. All in favor? Unanimous vote? Can we have the same vote on Senate Bill 858?
Yes, Senate 858 is, was referred to the Finance Committee from the Judicial Proceedings Committee, and the House bill was sent here, and 858 has been amended to be identical to House Bill 1144.
So all in favor of Senate Bill 858? Same vote? Okay, same vote, both amendments.
And that's favorable with amendments. Okay, next to many House bills that don't have cross files. And these House bills all came over, they were all, I'll begin by saying they were all sponsor only, so there was no opposition at the hearings. The first bill is House Bill 450. This requires the Maryland Transit Administration to automatically renew, based on regulations adopted by the administration, the Disability Reduced Fare Program certification of an enrollee who is permanently disabled.
Senator Ellis and Senator Washington, all in favor of House Bill 450?
Are we voting?
We're voting, Senator Reed? Yes?
Yeah, sorry.
Yeah, unanimous vote.
Okay.
Tell me about it.
I guess I shouldn't be complaining to you.
Okay.
Okay, the next bill, House Bill 527. This requires the MTA to develop and implement a program to provide for the first month after transit service that the Purple Line begins, ridership on the vehicles at no cost to individuals residing within a 0.25-mile radius of the track, and beginning October 21st, 2025, and until 3 months after transit service on the line begins, promotional materials and services at no cost to small businesses located within 0.25-mile radius of the Purple Line track. The MTA is directed to only use internal resources to implement the program. There was no opposition at the committee hearing, and there's no amendments.
Favorable, please, on 527? Oh, Senator Jackson?
That's right.
If they live, what is it?
0.25
What I imagine is
miles.
they're going to send out vouchers and only send them to the people.
Well,
that
the
are in that
administration
radius.
will adopt regulations to implement the section, so I guess they'll have to come up with some measure to determine where you live.
But we don't know.
These people will get a month free.
It's really to encourage people to try this transit and use it instead
it's
of using the
because-
car.
Demand. Why do we have to get encouraged?
Reclaiming my time. No, just. I'm just saying this is because these consumers were somehow disrupted with the construction of the Purple Line.
Yes.
Right. Have we done anything like that for any other jurisdiction before?
Not for a jurisdiction. We've done free passes for certain, like for MTA, for the light rail, for different groups, but no, we've not done it because of construction. These people have lived with this construction for,
Yes.
there we go. Senator Washington knows some of them are your constituents, aren't they?
Most of them are. A lot of them are. Thank you, Madam. Well, did I take your time? Okay. My constituents as well, this is Baltimore, this is Prince George's County and Montgomery County, the purple line where it sits, and our communities have been devastated by the construction of this, especially our small businesses. And so what this bill says that, which I don't really agree with because I think it should be wider, a 0.25 mile radius versus a half-mile radius, which is what we mostly do in some of our land use and zoning. But this was a compromise between the sponsor of the bill and MTA to get to the 0.25 miles, and these people deserve it. Right now, we're currently doing this for the University of Maryland students and faculty. The first month or first few months, they'll have the ability to ride for free.
Because it comes right up through the university.
right through the University of Maryland.
And through the Capital Region Hospital, right?
It goes through New Carrollton Metro Station, goes through the University of Maryland, Kenilworth Avenue area, and then through University of Maryland College Park and then down to Bethesda.
Thank you, Senator.
No, I think it was an MOU that was signed between the two.
Senator Hershey?
Oh. I put that on a long time ago, and I have to be honest, my colleague said, I'm not completely a fan of it, but it's going to be everybody anyways. I mean, we ought to just write it that if you want to be, that they can give free ridership to anyone, because it was 3 months to begin with, and then they went down to 1 month.
You heard Senator Washington say they had to negotiate this down from a half a mile to a quarter, from 3 months to 1 month, so,
Good work on your part, Senator. I mean, I know it's a tough issue, but I do kind of think, there's only one way to get people to ride it, and that's to introduce it to them, let them do it, but
thank you.
I'll vote against it.
Any other questions? All right. Yes.
I'll be voting no. I'm actually sympathetic to the issue in some ways, but, this idea it's going to get them to try it and all that. I know some of it's the idea of a little bit of payback, and not in a bad way, in a good way for the inconvenience. We already have free ridership because I tell you, up at the light rail in Hunt Valley, they don't ever check anybody's tickets. So I mean, we got to get serious about what's going on in our transportation system. I know when we have the debate on the gas tax on the floor, everybody says there's, we can't afford to take the CPI out, but we don't have a CPI on fares. Mass transit sucks so much money out of our transportation trust fund for not that many people that use it. And so now this is a free month. So I look forward to this being on the floor because I think there could be a lot of interesting things to bring up as part of this bill discussion. But I think I'll probably be voting no.
I just want to tell you, there's a lot of people in Linthicum that ride it free too. But I think this is an important bill it's been, how many years, Senator Washington? Yeah, it's been awful for the people and the businesses there, so. All right, so if we've had enough discussion, I'd like a motion on House Bill 527. Senator Washington moved favorable. Do I have a second? I'll second. Senator Kramer moves second. All in favor of House Bill 718, please. I think we need to call the roll. You guys are driving me crazy today.
House Bill 527 favorable. Vice Chair Hayes.
Yes.
Yes. Senator Kramer.
Yes.
Yes. Senator Reedy.
No.
No. Senator Ellis.
Yes.
Yes. Senator Moutz. No. Senator Jackson.
Yes.
Yes. Senator Washington.
No.
Yes. Senator Guile. Senator Guile.
Yes.
Yes. Senator Lamb. Yes. Senator Hershey.
No.
No. Madam Chair.
Yes.
Yes.
Okay.
8-3.
718, House Bill 718 was heard the other day. It reestablishes the Maryland Health Insurance Coverage Protection Commission to monitor potential and actual federal changes to several things: the Federal Patient Protection and Affordable Care Act, the Federal Mental Health Parity and Addiction Equity Act, Medicaid, the Maryland Children's Health Program, Medicare, and the Maryland All-Payer Model. The commission must assess the impact of such changes and provide recommendations for state and local action to protect access to affordable care coverage. You have an amendment in front of you, or a reprint. During the hearing, some folks wanted to be on this commission that weren't put on by the House, and that would be a representative from the National Association of Insurance and Financial Advisors, and also a representative of the Maryland Association of Counties. There was no opposition during the committee hearing.
Can I have a motion favorable for House Bill 820 as amended?
718?
I'm sorry. Do I
718.
move- Oh, I'm sorry, on 718 as amended. I moved one. Senator Guile, do I have a second? Senator Ellis, Senator Guile, Senator Ellis. All in favor of House Bill 718 as amended?
It's a party.
All right,
Are we
we need
interested
to,
if the Senate bells are ringing?
are they ringing?
I've been texted. that-
Okay,
that's the-
let's finish this vote. Tammy's going to call the roll on House Bill 718.
House Bill
Yes.
718 favorable with amendment. Vice Chair Hayes, yes. Senator Kramer?
Yes.
Yes. Senator Reedy?
Guess I'll be busy tomorrow.
No. Senator Ellis? Yes. Senator Mouts? No. Senator Jackson? Yes. Senator Washington? Yes. Senator Guile?
Still have more.
Yes. Senator Lamb? Yes. Senator Hershey? No. Madam Chair?
Yes.
Yes. 8-3, the bill passes.
All right, stay tuned. We'll be voting tomorrow. The bells are ringing. See you all on the floor.
Who's doing transportation networks?
Me,
You?
yeah.
Where it says David after the.
Yeah. It was going to be the next, well, it was 2 bills away.
2 bills away.
If you look at the voting
You
list,
have
Kramer,
amendments?
that right down this column is the name of the analyst. And that makes that question that you just asked kind of unnecessary.
Okay, this one is, I believe, has already been drafted and submitted to the committee. Here are
I haven't seen these.
3 more.
Are you going to load it up?
I've been told the bill sponsor is comfortable with all of them, so can it be, can I introduce it this way, or do these need to be drafted in that format?
Well, I mean, one way or another.